research. In the COVID-19 context, it was able to provide the PCR testing not only in Ghana, but also in 9 neighboring countries, thanks to the human resources and testing systems strengthened by Japan's contributions. In Vietnam, the medical network of the core hospitals established with Japanese cooperation over the years have served as the foundation of the COVID-19 response. And also, as already noted by my sounds a little bit longer, so that's why we call ACFeed for that, towards its full-scale operation, both financially and through technical assistance.
Reaffirm that government of Georgia remains strongly committed to achieving universal coverage with health services by 2030. Our new health strategy, adopted in May this year, sets ambitious but realistic targets for strengthening health systems and eliminating remaining disparities in access to quality health services, safe and effective drugs and vaccines. Like many other countries globally, in Georgia, COVID-19 has posed critical challenges to a health system. The health sector has been operating in a very complex economic, social and healthcare environment. The COVID pandemic showed us again the importance of primary care and public health services. During the pandemic, we have observed very strong interconnection and synergies between health security and UHC policies and interventions. Dual efforts were undertaken aimed at addressing devastating consequences of pandemic on the one hand and at maintaining uninterrupted access to essential services on the other. Building on experience of pandemic period, the government will continuously invest in strengthening public health laboratories, ambulance and emergency coordination centers, and other healthcare institutions. To maintain adequate establishing a patient-centered health service model that would be comprehensive and fully aligned with best available evidence on effectiveness and improve coverage with the state-funded programs by making the benefit package more comprehensive.
Thank you, Excellency. Appreciate Georgia's commitment and also your highlighting of partnerships and how important that is for moving.
Thank Thailand, Japan, and Georgia for hosting today's event, together with our partners at UHC 2030, IFRC, and the UN Foundation. 3 years ago, we met here in New York for the first high-level meeting on universal health coverage. We knew nothing then of what lay just around the corner. The COVID-19 pandemic has demonstrated in devastating fashion that when health is at risk, everything is at risk. The pandemic is not just a health crisis. It has disrupted businesses, economies, schools, families, societies, and more. Financial hardship in doing so. The pandemic has sent us further back, with over 90% of countries reporting disruptions in essential services. Compounding this are the existential crises of climate change, food insecurity, and prolonged conflict. We live in troubling times. The need for universal health coverage in all countries is more obvious and urgent than ever. Our resolve must be stronger than ever, and our vision must be higher than ever. That's why one of WHO's top priorities for the next 5 years is supporting countries to make a radical reorientation of their health systems towards primary health care at the foundation of universal health coverage. We know that 90% of essential health services can be delivered through primary health care. Investing in primary health care could have over 60 million lives and increase 60 million lives saved and increase global life expectancy by 6.7 years by 2030. But we also know that there remains much work to be done to expand service coverage and financial protection, especially for the most marginalized and hardest to reach groups. After all, it's not universal health coverage if it's not universal. The conundrum many countries face is the urgent need for increased public financing for health at precisely the same time when economies are stagnating, budgets are squeezed, and inflation is rampant. We get it. There are no quick fixes or short-term solutions. Most countries won't reach universal health coverage tomorrow or next year or even by 2030. But unless we all move with intention down that road, we will never get anywhere. This is mission critical for WHO. It's central to what we do and who we are. We are resolutely committed to supporting all countries, inch by inch, village by village, to increase access to services and reduce financial hardship. The WHO's special program on primary health care is now supporting 120 countries with a focus on the least served, most marginalized populations. But we can't do this alone. Through the Global Action Plan for Healthy Lives and Well-being for All, we're working with our multilateral partners to support countries to deliver on their commitments on UHC with a focus on primary health care. A year from now, we will meet here in New York for the high-level meeting on UHC. The world has changed, but our ambition has not. A world in which no child misses out on vaccinations, no household need decide between food and medicine, not health for some, health for all. I thank you.
And everything WHO has done during the pandemic and will continue to do to achieve the agenda. I think that you have to leave, and I believe Minister Yoshimasa also has to leave. I would just like to thank. I would like to introduce our next panelists that we're lucky to have with us today to talk about their experience with advancing this agenda. We have Senator, the Honorable Ms. Kamina Johnson-Smith, the Minister of Foreign Affairs and Foreign Trade from Jamaica, the Honorable Mr. Peter Siorto, Minister of Foreign Affairs and Trade of Hungary, and the Honorable Mr. Sanjay Verma, Vice Minister for Foreign Affairs from India.